Namaste. Welcome to part 2 of Psychoanalysis and Homeopathy. Why is net-mure? In the first part, we just rolled out the canvas, got acquainted with the fundamentals, and we are now ready to go into the difficult, complicated part of the subject to enter into the specifics of net-mure and how they can be psychoanalytically explained. To carry on the conversation forward, I hand it over to Dr. Suman Bhagat.
Namaste. So now coming to your concept of the tree of trauma, how does that apply to net-mure?
The idea of tree of trauma is like this, that in early childhood there is a trauma, and that trauma predisposes you to creating more traumatic points in the line of development. Like, for example, if you have an early life loss experience between say 3 months to 15 months, and then you go into the anal phase, you are already going predisposed not to resolve the anal phase completely. I mean, you're already carrying unnatural load on the psychic system. When you go to Oedipus, again you have the combined load of the early loss, the anal problems, and with all of that you enter Oedipus. So whenever in the developmental line, so I was saying, whenever in the line of development, at any stage a problem occurs, it affects the subsequent stages. So the one trauma leads to other minor traumatic points. And these minor traumatic points need not be minor, often they become major. So what happens is you have like a root and the tree, the branches, the leaves and the fruits. And the fruits are the symptoms. The leaves are the pre-symptom stages. Any leaf can convert into a fruit. And then you have the branches. And in healing, usually what we do is we have to move from the fruit to the branch to the trunk to the root. If you directly try to go to the root, the aggravation is so high that few people can actually take it. And that is very true in psychoanalysis, at least. I will not say about homeopathy. You are better placed to say it. But in psychoanalysis, usually it's easier to go from the fruit to the branch to the trunk to the root. Directly, if you go to the root, it's too unsettling and many people will go out of the therapy. They will eject out. So what we have here is the core events the core trauma leading to other trauma, and both of them leading to templates of analyzing, feeling and behaving. And they in turn give rise to life realities and symptoms. So the templates give rise to symptoms, or the bottled up effect in the complex gives rise to symptoms, or they lead in turn to specific behavioral patterns which in turn make life more difficult. For example, early life loss will create attachment difficulties. This attachment difficulty will later on in life lead to loneliness. Loneliness in turn will lead to anxiety, demotivation, depression and somatization. So it's like one leading to the other. The root creates the whole tree.
Right.
Often you have one root creating 2-3 roots, 2-3 traumas, and often these traumas can become roots for other trees, which means the tree of trauma is not a simple tree. In more difficult cases, it's a banyan tree, where the outcome of one trauma is many trauma, and they in turn become new roots for new trees to develop. It's like a banyan tree kind of thing. So the tree of trauma is different for different people. In some cases it's simple, some cases more like a complicated banyan tree. Now luck also plays a major role here. That how luck has been. So this is how the tree of trauma, let us say, for example, somebody had a difficult childhood, but after 5 years of age till puberty, he had a very good parenting from the parents and very good school experience, very good neighborhood experience. Then the earlier difficulties would be softened to a great extent.
Right.
So what is experience pre-trauma and post-trauma also are important as the trauma is important. Because if pre-trauma there were not too many good experiences, it's a difficult situation. Post-trauma, not good experiences, also a difficult situation. Trauma very intense, also a very difficult situation. So it's a net algebraic sum of all the three. So this is how the tree of trauma operates. And in situations where you just look at the root and you forget about all the characteristics of the tree, that's the classical miasmatic approach, where
Right.
so that I was saying was the classical miasmatic approach, where you forget about
So
the
now let us take up a few distinctive characteristics of nephremute and have a psychoanalytic.
हाँ ठीक है, please go ahead. Let us say we can take up two. One is the sensitivity to sunstroke.
Miasmatic.
Hello.
Is that okay, sir? Yeah. So let us take few distinctive characteristics of nephremute and have a psychoanalytic explanation on it.
Yes, we can take up one of them can be, say, sensitivity to sun, a very distinct characteristic. And later on, we can see the fondness of salty foods, and we can see how psychoanalytically we can look at it. So let's start with that sensitivity to sun. There can be a variety of ways this can be explained psychoanalytically. One is because of difficult affect being generated by the trauma, specifically sadness, anger, and guilt, and in some cases shame, the repression inside is very severe. And that repression process puts a lot of strain on the nervous system. So over a period of time, slowly the nervous system tires out. And this happens in case of any strong repression which is done for years in a chronic way. That at the end of 15 years, 20 years, you will see some issue in the nervous system coming up. So one explanation would be that long years of repressing, especially when the season is changing, at that time the repression becomes very difficult because all the bottled up emotions, they flare up. And therefore, you will see worsening of net mure, and many people like net mure during the season change, because in season change, the whole energy of the body goes up, which means energy allocated to all the complexes goes up, good, bad, and ugly, and you have more of bad and ugly and less of good. So the flare up happens and the huge repression has to be done, and that tires out the nervous system, and so much has to be repressed that despite the best efforts, still the somatization is taking place. And the somatization happens involving the nervous system. Like there is intense stress on the nervous system, the kind of stress which is analogous to what you see in epilepsy. That kind of stress, I'm not saying exactly that, but somewhat like that, that tires out the system, and therefore you will see this coming up in many net mutes after 10-15 years of the difficulty starting, not immediately. There will be some net mute with very delicate nervous systems where this will happen very fast, but most of them this will happen after quite some years of difficulty. So let us say if the difficulty starts at puberty, you will see this after 32, 33. 1. 2. It can also be in some net mutes self-attack, self-destruction. Meaning, if you ask them, those who are sensitive to sun, many of them will say that before this started, I was actually feeling best in sun.
Oh.
Yeah. So they are now attacking the only good thing that is remaining in them, because the repressed anger and the sadness is so much, and they want to express it or take revenge from those they are unhappy with, but they cannot do it because of very strong morality or reality. So then it turns inwards and self-destruction starts. And one aspect of self-destruction is destroying that very thing which is good in us. So if a netmure feels good in summer, he will now attack his being good in summer. So it can be a self-destructive process, and that will be true for netmure who say that before this sunlight difficulty started, I was feeling best in summers. So now I have destroyed the only good I had going on. That would be second. The third will be, many times it's a over a period of time thing, that because of sadness somatizing in netmure, leading to a lot of mucus difficulties, they take hot foods for a very long time in order to overcome mucus, but it never helps because the mucus is not being generated because of cold foods, it is generated because of somatization of sadness. So what happens there is the uh, mucus is not healed, but instead, because of excessive intake of hot foods, the sensitivity to sun starts. The pitta component goes up. So that's the third story. And the fourth story is, in many cases, there will be some story related to exposure to the sun. For example, in some netmure, it will be that I have to travel in the bus or walking or on a two-wheeler in the sun, and it's very uncomfortable, and every time I am there, it reminds me of my non-success in life, it reminds me of my failure in life, and it reminds me of a narcissistic injury that I have incurred. That being in the sun has a story of defeat, of failure, of misfortune woven around it. So this is the third story where there is psychoanalytic story of the symptom in netmure related to the exposure to the sun. So these are 3 or 4 psychoanalytic explanations of why he is so sensitive to sun.
Right. Very nice correlation between psychoanalysis point and how this homeopathy point of view.
Yeah,
Because
please go on.
we generally take aggravation from the sun and all, but why it has come, that
Yeah,
the psychoanalysis point, it's
correct.
very good.
Yeah. The unconscious stories of that feature.
Right.
So any personality we take and we take a feature of that personality, you can always have a psychoanalytic story of that feature. And of course, it can go wrong. For example, we may see psychoanalysis where there is no psychoanalysis. Let us say there is a netmure in whom all of this is purely biological. It may happen, but it will happen in few cases. In most cases, there will be a psychological story.
Right. So how the salt come up as a second important factor now.
Yeah,
Desire for salt and salty food. How do
correct.
we take that thing?
Uh, One is, as I said, it may just be pure biological deficiency, in which case psychoanalysis is the thing to say, it's outside of the bounds. But let us say where psychoanalysis is at
Okay.
play, what explanations are there? One, uh, it's a statement that life has become tasteless, it has become bland, and I want to add taste to life. And one way to do it is to add salt. That the
Okay.
expectation of a very juicy and spicy life has been completely frustrated, and the person is now leading a very tasteless and bland life compared to his expectations. It may not be absolutely true, but compared to his expectations, that is what is the story inside his mind, and therefore the salt. That is one. Second is, uh, he may be dealing along with this, with loss, emptiness, and anxiety, and that creates anxiety. I mean, loss, emptiness, and anxiety. And to overcome that anxiety of loss and emptiness, he has to fill up himself to cover emptiness, and he has to do something to manage the anxiety. And the salty food helps him do the both of it. Now, this is very alike. Some people in bipolar range, they use sweet food to overcome the same thing.
Right.
Some other personalities, they use sweet food to overcome the same thing of loss, emptiness, and anxiety. That the moment loss, emptiness, and anxiety activate inside, they need something to uh, overcome the loss and emptiness, which they do by putting in food, and overcome the anxiety by putting it a pulse of pleasure, because the pleasure produces a converging effect to the fragmenting anxiety. It produces a contraction in the nerves of some sort, which produces a converging effect and prevents that anxiety. And the attention shifts and the centripetal action is generated. Right? So the second story of the salty food is this, that one group of netmure will be using it to overcome the activation of loss, emptiness, and anxiety. That is second. Third, there can be a story related to this, that somebody they were close to was fond of salty food and the person is no more, or the person has deserted them. Now they cannot manage the loss. So in order to deny the loss, they take on the characteristic of the person they have lost. So unconsciously they say that because salty food is being consumed, that person is still there. It's a very unconscious way of denying loss, which is what happens in case of death. That when we lose somebody, we start taking on characteristics of that person. Right? Let us say some person we are close to, he was putting water to tulsi plant every day, and he dies, then we take on that thing. Not because we are the only person, somebody else is ready to do it, but we don't allow that person to do it because we want to deny that loss.
Right.
Because complete mourning is not possible given the amount of sadness and given our capacity of mourning. So that can be one reason for this salty food. And fourth can be self-destruction. That knowing fully well that salty food is harmful to me, I would deliberately take it, unconsciously of course, as an act of self-destruction. And this is deeply related to the bottled up anger and a very deep disappointment with life. And after midlife crisis of 42 to 45, this will go up radically, because that is the age where disappointment becomes very deep and it goes to the extent of resignation. So these are some of the ways we can psychoanalytically explain this feature of netmure of desire for salty foods.
Right, right. Very nicely explained, sir. Now, another thing is the remedy natremure then healing early life losses, split, or Oedipus?
This is a difficult question. I don't have an answer to this question. That does not mean I will not answer this question. I will go like this. We don't have an exact answer, but we have a schematic rough answer, inexact answer. And the inexact answer is like this. If we conceptualize trauma, like Jung said, it's a complex, and Jung defined it as idea toned with affect, meaning at the center there is a thought, idea, and around it is feeling, and both of them are held together by some sort of force, almost like a magnetic force. And there is a refractory nature over it. It does not allow the healing process to come into it directly. So there is a refractory process, refractory surface around it, and also there are healing forces around it, the natural healing forces of the system. So this is how the constellation of trauma is. There is a core idea, there is feeling around it, the two are bound together by some sort of force, binding force, there is a refractory nature around it, and there is a healing system around it. And this trauma inside the refractory system is trying to self-perpetuate and develop itself and release itself in the form of symptoms and further development of the tree of trauma. That's the conceptual idea and development of the system called the trauma. Now, when we say that healing happens, it can happen in any way. Some remedies will be healing by releasing the affect which is trapped. Some remedies will be healing by undoing the entire complex. Some remedies will be healing by strengthening the healing force outside. Some remedies will be healing by removing the refractory nature around it. And some remedies will be healing by healing the core idea. And some remedies will be healing by nullifying the binding force. Now, we don't know what remedy works in what way, but definitely we know that in some of these generic ways or a combination of this, the remedy has to work. If we take the basic principle that trauma somatizes into a symptom, right, and the core healing of a chronic disease is the healing of that core trauma, then the core trauma is conceptualized in this way, then healing has to happen only in some specific ways or a combination of it. It cannot be anything else. Now that we don't know how it happens, but certain things we know. For example, say ignitia. Right? If we take ignitia and we take the plant remedy and we say that the core of the plant kingdom is sensitivity and the response, right? The unattenuated hysterical response. So if we take that, which means that in some way ignitia is working upon sensitivity and ego strength, which will help to attenuate that uninhibited response, hysterical response. Right? Now, in psychoanalytic terms, it will be like this, that in ignitia is somehow working on sensitivity and ego strength.
Okay.
That will be the psychoanalytic way of looking at the working of ignitia. Apart from many other things it does, definitely it will do these two things. So this is the way that we look at it, and there we look at the whole idea of whether one remedy can cure completely or partially. Right? Let us say some remedy is working only on removing the refractory nature. Then it will be relative strength of the trauma and the healing forces. And it may result in full or partial cure. If some remedy actually can go into the core of the idea and undo the idea, the healing will be complete. If some remedy can reduce it to some degree, but then it cannot reduce it any further, it can only give partial cure and some other remedy has to be tried. Because then the nature of trauma is such that it will not allow it to go in any further once it reaches one level of compression. So we are looking at a non-linear system which has 4 or 5 variables inside, and there are different ways of undoing this whole constellation. So it's like, for example, if I give a analogous example from allopathy, let us say you want to kill a bacteria. You will have one medicine which will go into the genetic code of bacteria and destroy the genetic code. There will be another medicine which will destroy the circulatory system in the cell, not touch the genetic part. There will be third medicine which will cover up the bacteria and not allow the food to go in or oxygen to go in. Right? And all the three will be killing bacteria in different ways. The same way we can look at this thing, that maybe there are multiple ways of healing, unraveling that constellation of trauma and going into it. So this is how one can conceptualize it.
Now this all, it brings us to another very interesting subject of movement of the person from one remedy to another, or the idea of complementary remedies.
Correct. So there the point is, the movement will be a healing movement or a deteriorating movement. It's like, let us say in the table, you are moving away from lithium or towards lithium on the horizontal scale.
Right.
Or you are moving towards the upper end, which is more difficult, or the lower end, which is slightly more healed. So there will be a movement, and the movement will be actually reflecting uh, how we are able to heal in that tree of trauma, going from the fruit to the branch to the trunk to the root. The more we go into the healing process, the more we will be moving on the healing path. It's like moving from, let's say, lithium downwards, lithium to sodium to potassium. It is still a better state. So as the psychological thing gets healed, if we are not into a single remedy situation, then it can put forward a healing proposition, or it can put forward a deteriorating proposition. Or it may lead us to a situation where we have to alternate two things, because the constellation of trauma is such that we have to have something to heal sensitivity, and then something to release affect. Again, something to heal the idea, and then something to heal the binding force. In that psychoanalytic conceptualization of trauma, this is how we will look at the necessity of different medicines, movement along different medicines, or the need for complementing medicines.
Right.
Like,
So
for
now, can
example,
there be a general?
if you come, for example, to net mure,
Yes.
in some net mures, they may never need an ignitia.
Okay.
Now, psychoanalytically, the explanation would be this, that if it is primarily not because of sensitivity uncontrolled, because ego strength usually net mure will be much better than in case of ignitia. The need for ignitia then will be where the sensitivity is like ignitia, but with a severe ego strength. So the ego strength will not allow that high sensitivity to give that hysterical response, but the high sensitivity still is a problem. So that is where the need for ignitia will come or not come.
Right.
Psychoanalytic way of it, maybe there are 10 other reasons for it, I don't know. But from a limited psychoanalytic window, this is how it comes out.
Right. Very nicely explained, sir. So now, can there be a general resistance to healing per se in chronic psychological cases also?
Yes. Yes. Like, for example, there can be some generic uh, resistances to healing. Let me list out psychoanalytically what they are. There may be some biological also, which I don't know, but psychoanalytically I can list out. The first is self-destruction. If the aggression, the death instinct, bottled up aggression, bottled up sadism is very high and cannot be expressed, it turns inwards. And that self-destruction is of very high order. If it crosses a particular line, it's difficult to cure with anything. It is like the extreme case of syphilis, miasmatically, if you speak, right? So in psychoanalytic terms, it will be extreme self-destruction because of very high death instinct, very high aggression and sadism repressed, turning back on oneself. The second case is of fixation in primary narcissism, where and this will happen in case of schizophrenia. Some cases of schizophrenia with negative features. I'm not talking about positive features. Schizophrenia with negative features, where there is withdrawal, intense withdrawal, right? And I am not talking of catatonia. Catatonia also there is extreme withdrawal, but not that. I am talking of schizophrenia with negative features, but not catatonia. That range will be having a very large group of people with fixation in primary narcissism, which is so pleasurable that the person refuses to give it up. Because for him, becoming normal is like giving up a sweet shop for 1 kg of sweets. Why will he do it?
Right, right.
The third case is the secondary gains. That when I am sick, I am very interesting. I don't have responsibility. I get attention and affection. So for dependent personality, it's very difficult to give up. And anybody who has dependent component has difficulty in giving it up. The third case, where one does not want to get well. Fourth case,
Right.
in some cases, it's relief from torture. That every day is so difficult in the family that when you are sick is the only way where you get relief. So you don't want to give up the only few days of relief you have. That is fourth. And fifth is the anxiety of the unknown. Right? Because many patients have told me, what will I do without a problem? Because I'm so used to it for so many years, right? That I don't know.
Right.
Anxiety of good health. I don't know what it will be like. Because for me, good health is an unknown. I have been with a chronic sickness for
Right.
20
They like to live than problems.
because it is known and safe. They know that with all the trouble of the sickness, I have still survived. It's a known devil, a familiar devil. And I have survived with that devil. But with the new state of health, I don't know what it will be. The fear of unknown is very high. And that includes the fear of health, which is an unknown to them. Right? And then they also fear loss of attachment with all the healers and caregivers. Right? And they don't know what purpose of life they will find. So they have this statement, what will I do without a problem? So these 5 categories are where it's difficult to, if they become very intense, it's difficult to try any remedy and heal them.
Right, right. Very interesting. Very interesting and very true. We see this in our daily practice also, right? Interestingly and revealingly and perhaps very controversial part we have discussed,
Right.
and yet a very meaningful conversation. Uh, hope everyone likes this, and see you again, sir, in
Yeah.
our
And
next
yeah, next
discussion.
conversation, yeah, next discussion will focus more from your side, and let me try to understand it from your side, how you look at it from homeopathic standpoint. Hmm? Okay.
Sure, sure, sir.
Namaste.
Okay. Namaste, sir. Namaste.